Hi, I'm Mike Church and I'm here in Bridgend with Men Shed TV and I'm talking to
Claire Amos. I'm a registered nurse and I run my own medical aesthetics clinic in Bridgend.
And before we came on air, it's amazing the stuff that I've been talking to Claire about and we've had a long conversation. Let's start though just to find out a little bit about that aesthetics clinic, Claire. When did you start doing it and what was your background getting into it?
So I have been a registered nurse since 2004 and it was in 2010 that I was working night shifts and I thought, what can I do to earn a little bit more money, not work as many night shifts? And I'd had an aesthetic treatment myself and I thought, yeah, I could do this. So I went, did some training in Harley Street in London. And I started building very slowly a few patients, doing some facial aesthetics, but really loved it and actually found a passion for that. I still did that part-time right up until 2021 when I left the NHS. My background was intensive care nursing, some A&E nursing and a palliative care specialist nurse. So before I finished in the NHS, I was a specialist nurse in palliative care.
Men's health. Let's talk about men's health because obviously, you've told me earlier that men don't go to the doctors as much as women statistically. Yeah, is that true?
True, absolutely. Men are much less likely to visit a GP in their lifetime than a female. Okay, they tend to go when there's something wrong, whereas females, we can go for contraception, talking about menopause. They might pregnancy related, then they take their children. It does lead on to other conversations. Men are less likely to do that.
And what's fascinating to me, Claire, is you talked to me off camera before we started. You were talking about, obviously there's the menopause for women, but you were saying actually that we don't take seriously enough in many ways that men can go through quite life-changing losses of things going on in their body that they do need to replace. Yeah. Can you tell me a little bit more about that? So
men also go through a menopause. It's called andropause.
It's official.
Okay.
You go through a menopause.
You do. And that is, it's a known fact, okay? Again, that isn't checked. A lot of men will present with mental health problems, which I know the Men Shed see. This can be a decline in testosterone levels and other hormones that are vital to men's health. It really affects the brain a lot. They can be feeling depressed. They started on antidepressants. But if it is a testosterone problem, the antidepressants won't work. Men can suffer in silence for a long time and really sadly, more men commit suicide than women. And it's a huge problem because some men, there might not be an underlying problem that they think of. Their marriage is okay, they're not in any debt. People will say, but what's wrong with you? You've got a great life. It could be hormone related. If men are feeling like that, go to the GP, say, look, my antidepressants aren't working. I've given it 2 months, 3 months. Is there something else? Can I be tested for hormones? If the GP won't do that, we can do that privately.
But you see, that's a revelation to me because I'm over 60 and I'd never heard that. I didn't know. Maybe there's lots of men out there listening to Men Shed TV who thought, well, we all knew that. Well, I didn't. No. And I always thought about steroid use and stuff like that as like, it's always like, oh, he's ripped, he is, don't ask him out. It's all that with steroid stuff. But you're saying that actually a low dose of steroid or some of those things sometimes might be a right way forward for someone.
Absolutely. But the best thing to do is have it tested and, do it properly because people will self-medicate. Right? We see that a lot in my aesthetic clinic. People are buying counterfeit products like Botox and weight loss injections. They're huge at the moment. But men are looking for replacement of their hormones. They go into gyms. They're buying it from gyms. A few of my female patients who are 55, 60 years old have said to me, I don't know what's wrong with my husband. He sleeps more, he's a bit more grumpy, there's no reason for it, we need a holiday. And they've asked me, could you do some testing on him? Their friends are using steroids from the gym, they feel amazing, okay? I don't recommend that, that's not great. we shouldn't be buying products and injecting ourselves or taking anything that isn't prescribed. I'm a prescriber.
You're a prescriber, so you're saying there is a problem with regulation.
Yes,
the only stuff you should be taking is stuff that's regulated.
Being prescribed.
If I came to you and you told me a lovely story of how you don't necessarily jump to treating someone,
No.
you sit and chat with them and say, why do you want this treatment? If I was coming and saying, I'm feeling a bit low, I just want a bit of this, that, you might say, no, it's not that, Mike.
Yeah,
you might
that's right.
Go and get yourself tested for that. You do that.
As an ethical practitioner and a medical professional that needs to uphold standards, okay, I've got a nursing and midwifery PIN number. I take that really seriously.
Yeah.
People think, oh, she's just injecting. I've had quite a lot of backlash sometimes on Facebook pages. I try to introduce blood testing on a hub, and I said, if you can't get a blood test from your GP, I'm happy to help you with that service. Again, hardly make any money from that. I give it my time, I send it to a private lab. Within 24 hours, their results are back with a plan. You know, I just found out I've got a high cholesterol. I'm 44 years old. That shocked me because I don't think I'm particularly overweight. I'm quite healthy. But again, I do those tests in. My GP's never tested me for that, you know, and I think there can be a lot of backlash, but I'm very ethical and I make sure that people are choosing treatments for the right reasons. Psychologically, people need to be in the right place. So again, I had a male booking, late 40s. Didn't come with a partner. Usually a lot of my male patients come with their wives or their partners. So straight away I thought, oh, what's his motivation for treatment at this age if he's never had them before? And he came in, he'd never had a treatment before. And I asked him, what's the reason you want a treatment now? You know, because that's important to me. I need to find this out, part of the whole consultation process. And he said, I feel a bit rubbish, you know. I wanted lots of things from you. I want that weight loss jab. And I said, look, have you tried other things first? You know, are you careful? Do you wear sun cream? Are you looking after your skin? Men don't tend to do that as well. And that's just the truth. They don't.
No.
And I think he left feeling better because I said, I don't think me putting Botox and filler and giving you weight loss injections is right for you at the moment. I think we need to work on other things first. Go away, look at your diet, do a bit of exercise, maybe just walking.
Well,
build walking into your routine every day.
I was going to say the whole social prescribing model, which
right.
I know groups like the Men's Shed, obviously, and Lads and Dads, which is another group in Bridgend Borough, they've moved. There's been lots of consultation with politicians about trying to improve men's mental health, and one of the things that they've moved to, I think, is doctors' surgeries can prescribe and say, have you thought about joining the Men's Shed and whatever? Because that can help your mental health, can't it?
Definitely. So again, we were talking about this, weren't we? That females tend to have more people to talk to. Again, and I'm not being judgmental.
No.
It's true, they might come to me. A lot of my patients come and they offload things, you know, completely confidential. They tell me things, sometimes they cry. We have a hug and I'm like, you know, if you need to chat again, come back, we'll just have a coffee. You know, I don't charge people for that. They're booking for a facial and they end up telling me things. That's great. And maybe from my background of being a palliative care specialist nurse, I'm able to listen to people, to talk to people, to know and how to refer. So have you thought about seeing your GP or going to somewhere like, you know, the Men's Shed if it was a man? But for females, lots of females have children. Some don't, obviously, but they have groups, mums and babies groups, toddlers groups. In the school playground, they go for coffee dates with the children. Men don't tend to do that. They go to work. They don't want to talk about, I feel rubbish today in work, do they? No. They just get on with it and, you know, they might go to the gym. Some feeling rubbish, stop going to the gym. Worst thing you can do. You need endorphins, you need to exercise. That might be going for a walk, going for a jog, swimming, going to the gym. A lot of men start to feel lacking in confidence, don't want to go to the gym anymore. They don't. They feel, I feel too rubbish to go there today. Will make them feel better.
I mean, you were asking me again off camera before we started about how the Men's Shed group movement started, and it started in Australia, I think, in the 1990s, when, you know, there was a known fact that men don't talk about their emotions, whereas women traditionally women have been much more sharing with each other, and so there was this idea that men will work shoulder to shoulder and talk over mending a lawnmower, whereas they wouldn't if you just sat two men together. They just all right, and that would be it, wouldn't it?
Yeah.
But just to mention the men's shed, the one I know well there is Chris Davis, Jip, who's the chair of the men's shed up in Kyra, and he says he was at such a rock bottom place that he was thinking of ending it all.
Yeah.
And a mate of his said to him, go to the men's shed, and he was reluctant, and he wouldn't go over the line. I think he was outside and would go in, and I know there's cases other people have told me there, men won't come in, they'll drive in the car, but they won't getting out of the car.
Isn't it?
Yeah, and I don't know, we can both talk about barriers there and how you overcome it. I don't think there's a magic solution, is there? What you've got to do is like you're doing with your clinic, is put stuff out there, lots of different ways, lots of different doors you could enter. If you don't want to enter that one, how about entering that one? So that
I know. And it's multifaceted, so there isn't always a reason. People can just feel, I don't know what's wrong with me, I feel rubbish.
No.
That's okay. That is actually okay to feel like that.
Yeah.
If you're feeling like that every day, then I definitely say people need to talk to someone.
Yeah.
Go online. Go to a group. If you don't want to visit your GP and you feel a bit, I don't want to go. The problem as well is people don't know their GPs anymore. You've got a pool. You see someone different every time. People don't want to do that. You might not need medication. You might not want to start on medication. Men as well don't want to be taking tablets. This might sound, again, I don't know if this is fully right, but I think lots of women are more open to taking medications. Men kind of don't want to do that. I don't want to do that.
I think when you said, I don't know the statistics on this, but I think if you were to check, because a lot of people take antidepressants, don't they? And I think it's women percentage-wise would take them more than men, wouldn't they?
Yeah, and because they go to the GP as well.
Men wouldn't go.
Men don't want to go. So finding somewhere else that they can build up these relationships with other men that are going through problems. There might not even be anything wrong. Like, I just don't. Isolation, loneliness. They might have separated. Look, when I was a palliative care specialist nurse, I used to walk into people's houses and not quite know what I was going to be faced with, right? So you'd have, say for example, one of my patients, female, diagnosed with a terminal cancer. The husband didn't know what to do. He didn't want to talk to his children because he didn't want to put on them his emotions. He has to be the man. You've got to be strong for your family, for your wife, for your children. He's crumbling inside. I need someone to talk to. Still working. Got to go in and do the job. Got to get paid. Where else can they go? Apart from, we were talking about this, down the pub, 6, 7, 8, 10 pints. You feel worse the next day, right? So take alcohol out of it and go somewhere like, like the men's shed or a group. Go online if you're frightened at first. Start talking to people. Find out that other people have got problems and you can help each other.
I mean, it's funny we talk about the barriers, isn't it? But in some ways, one of the biggest barriers is this negative connotation for men more than women to talking to people, isn't it? Telling your stories. Like both of us sat here, you've talked about your husband. We're both ordinary people. We're on life's journey. We've both had problems and both sought medical help and we're all, it's everybody out there. We're all struggling with it, aren't we? Everyone's struggling. But if you talk to people, as we're talking, it does help, doesn't it?
Yeah,
It gets you over that line and gets you to help.
Because when you see most people every day say, how are you? Oh, I'm okay. That's that, isn't it?
Yeah.
Everybody's in a rush today as well. Yeah. Everyone's rushing all the time. People are on their phones all the time. There are barriers to being able to talk, because
that's one of the wonderful things about you, Claire, and your clinic, is that what came across, first thing you said to me virtually off camp before we came in, was that you don't necessarily treat. You've had quite a few people walk out without having any treatment when you said, I don't think you need this. And I think that's brilliant, that there's not. Some people worry that they'll go in and they'll end up coming out with tablets or this or that.
Gosh,
But you'd actually sit down and say, what do you think you need? And let's have a chat about what you need. And you'd signpost someone in the right direction.
Yeah.
And that might mean walking out of here without, having to do any treatments, wouldn't it?
I do that a lot, and my patients like that about me.
Yeah.
Because they'll always say, if you look at my reviews, they will say, Claire is honest, and I went in expecting to have this, and then she said, that isn't suitable for you.
That comes across to me, the honesty of you as a person and your service. That really comes across. So, Claire, I wanted to ask you, traditionally, health and beauty are always things that are the domain of women, aren't they?
Yeah.
They're not men in terms of, men aren't generally, that I know, are trying to look as beautiful as they can, whereas women, I think, are all chasing a sort of glamour model, profile, aren't they?
Yeah.
And yet how many men are coming to your service? Do you get men coming?
Handful. They usually come with their wives or with their partners, and you've hit the nail on the head. Predominantly aesthetics and looking, especially facial wise. The females are more, they wear makeup, and social media. Huge now. Females feel like they've got, why don't I've got to look like this, I need to have this done, that done. And that's why I try to say, no, we're all individual, we've got to age as well. That's not realistic. You can't look like this picture. So when the men come in with their wives, they've got this picture in their head of, I don't want to look fake or unnatural. What could I have done? First of all, I say, are you wearing your sun cream? Really important. Every man, every female, every child, from the first decade of life, so from the age of 10 on, skin damage starts. Okay? The UV rays can cause us to get skin cancers. We need to avoid that by wearing sun cream. So I say to my males when they come in, are you wearing sun cream? No. Why not? So I sell medical grade sun care, skin care that is approved by the Skin Cancer Foundation. So, because they're not all equal. So that's really important. Start them on a journey with that first. Have a look at this. If you're interested in other treatments, start using that first. No point spending hundreds of pounds on facial treatments if you've not got the foundation right. You can't build a house on a mud patch. You've got to make sure the foundations are all right first. Same. Using your skincare is really important. My husband uses it now because he had the skin cancer scare. He wears SPF every day. I give him a really good one. He loves it. He's like, ooh, and he started to get interested. He's a wimp. He won't have anything else done, right? But
when he's not watching this,
he will be watching it, and he knows he's a wimp as well, right? So he won't have treatments then because he's a bit of a wimp. But there's lots of different treatments anyway. You can have some microneedling, great for the skin rejuvenation, natural skin peels. But I like the foundations right first. You're wearing sun cream. Are you committed to wearing that every day? Get that right first. And there's lots of treatments that men do have.
And what's interesting me, so I've got your leaflet here of the things that you offer in your clinic, and it's really interesting to me that you're saying that you've and continue to develop the clinic because there are different things that come along. Like, tell me about the mole treatments, for example, which is something you do, isn't it?
So it's called Map My Mole.
Right.
And basically, last year my husband found like a scab on his ear, and it was coming and going. He kept picking it off, and then it'd come back, and I said, that doesn't look right. And again, I'm not a dermatologist. Even though I run a clinic, I'm not a dermatologist, okay? But I knew it didn't look right. And I found this service, it was very new, Map My Mole. And this year, it's consultant-led dermatology service. And what I do, I've had some training online, and I've been sent a dermatoscope. And a dermatoscope picks up and magnifies any lesion or mole or anything unusual on the skin. And I said to him, let's try this on you. Within actually less than 12 hours, his report was back and said that he had something called an actinic keratosis that can develop into cancerous cells. He then sent the report to his GP. Within 2 or 3 days, he'd had a biopsy and started on chemotherapy cream, which was great because now we've got rid, hopefully, of those cancerous cells. And I thought, wow, why aren't we offering this service? So I've developed it in my clinic, and it's absolutely great for females, males. I do have to only scan people over the age of 18, unfortunately. My clinic insurance will only allow that. And I've picked up quite a lot of skin cancers.
How does body dysmorphia, how does that look for a man?
So for males, body dysmorphia, excessive checking in the mirror, looking at your appearance a lot of them will overuse gym steroid use. Huge as well for body dysmorphia. There are a lot of men that will start using steroids, and it's because they've got body dysmorphia, which is a shame if that's picked up sooner. I screen for females when they come into my clinic for that. Obviously, if they're presenting with something that I don't think they need treatment for, I'll delve into that a bit more and say, use the mirror, show me what you're concerned about. If they're pointing things out that I can't see, I start to worry if they got some body.
What about if I came and said, Claire, I'm bald, and I'm really missing having hair. Obviously, I've been bald for a long time, so I suppose it doesn't bother, or does it? I don't know.
Yeah.
What would you say about that? Do you offer a treatment that would?
So interestingly, there are treatments that can help with hair growth. I've got some great ones. So PRP and polynucleotide treatments are really good for hair, but it depends on the root cause of the hair loss. Right? So male pattern baldness. If you're genetically predisposed to being bald, it's not worth it. But in my training academy, I train people to do treatments for hair loss, and a lot of my male students, nurses, doctors, go on to specialise in men's treatments after hair transplants. PRP is great for that. So they tend to keep the male patients to themselves, which is good because they feel more comfortable, I think, going to another man. They can understand a bit more. Like my female patients will relate to me in certain ways, whereas the male patient might relate to a male practitioner a bit more.
Claire, I just wanted to ask you what direction you think, because I'm hoping that there will become not a complete equal sort of playing field between men and women, but maybe more men will start visiting, and if they do start visiting, I'd be questioning what they've come for, because people like, if you look in sport, people like David Beckham, me being bald for example, there was a time when people would, I still get kids who'd sometimes go, "Oh, baldy," but actually David Beckham made being bald a lot more sort of sexy, for want of a better word, because he shaved his hair when he was still in his 20s, still playing high-level football. Then you got Gavin Henson in the world of rugby, who shaved his legs and got a lot of flack, didn't he, for sort of like, not feminising, but sort of being a bit more in touch with his body and sort of making himself look good.
I know.
So and there'll be lots of men out there, but some men out there who stick to the 6 pints down the pub, that'll do me, or whatever. But there'll be other men who think, actually, I'd like to look better, actually. And so what would you say to those men who sort of like, because there might be a growth of people going, actually, I want to look a bit better. It's not all about this macho view. What would you say to them?
That's true, and there is more of a growth now for male treatments. So men are thinking about that, looking after themselves a bit better, looking at skincare. They want to keep up with their wives, because a lot of people say, oh, she's going to look, in her 30s, and I'm going to look like her dad. I get that a lot. So, yes, men will have some anti-wrinkle treatments, skin treatments, and sometimes they want to masculinise their face, so they'll have some dermal filler treatments as well. There's lots of different treatments that men can have. It isn't just for females. So I think that it can look natural. It wouldn't, if I said to you, we can do a couple of treatments on you, but you're not going to walk out here looking like, oh my God, what's Mike done? It'll be so subtle that you'll think, oh yeah, I quite like this difference, but other people are not necessarily going to think, oh my God, what have you done? Because you don't want that from an aesthetic treatment. I'm, a huge advocate on still looking natural and just replacing sort of the volume that's been lost, or just addressing some fine lines and wrinkles, not transforming and looking different. You don't want to completely look different, really.
Oh, that's really interesting. If we were summarising where we've sort of come from this morning, you've sort of what you're saying is that the domain is still largely women, and women sort of still, actually statistically, still cross the line of threshold of the door going into the doctors or whatever it is, or your clinic here. It's more women, but it could develop into more men. But what would be your message to men? From what we've talked about this morning, what would be your message to men out there saying, actually lads, number one, like I'd have one from what you're talking about, is number one, talk to people. Don't be afraid to talk to anyone, your mate, your wife, whoever it is, and talk to them. That's a big one, isn't it?
Yeah, the doors are open to places, right?
Yeah.
So men who feel isolated, who feel embarrassed, scared to go somewhere, they're feeling rubbish, they don't know why, or there could be a reason why. They might not want to talk to their family, their wife, they might not want to go to the doctor. My door's open as well, so if anyone needed a book in and have those referrals to places, or just have a conversation around making themselves feel better. Lots of people book in with me, men and women, for facials, but really they want to talk about other things, and that's absolutely fine. It's a safe space. Lots of clinics are. Find a medical professional that understands that holistic approach. It isn't about me making money, and yeah, of course I'm running a business, but for me, patient safety and well-being is always on the top of my list, always. And if I can do anything to help anybody, females or males, I think that's is so important for me. And picking up the phone, looking online, like you said, the men's shed, lads and dads, I think there's lots of places people can go for help, and I'm just a small fish in that. But
a small fish, but what I like about you, Claire, and I would advocate this for your business, if you see what I mean, that I didn't know you until today, and you've come across as a woman of integrity who, if I came to you and said, I don't know about this bald look, Claire, and whether I should change it, I know now that because I am actually okay with it, I think now.
Yeah, that's good.
But I actually think that if I wasn't okay with it, you'd sit down, you'd have a serious conversation with me, and you might say, yeah, but you'd sit me down and you'd say, well, Mike, here's what I'd suggest, and you wouldn't be necessarily thinking about any treatment. You'd be genuinely interested in what's best for me. So I think
that's right. And finding out your motivating factors to now sort that out.
Yeah.
You know, I think that's really, really important, and people need to remember that. You're not going to come in and walk out, oh my gosh, I've just spent £1,000 and I don't even know if it'll work. That's not good, is it?
I tell you what I'm going to take as another takeaway from this, though, everyone, sun cream.
100%.
Because I'm of the generation where, sun cream, but actually hearing you talking about your husband, who's not a wimp, I'm just sticking up for him, I actually think, because my other half is always on to me about sun cream, and I'm going to wear it much more religiously.
I'll give you a sample today, Mike.
You think about moles and stuff as well. That's very real, isn't it? And you also talked to me about prostate cancer, which my father had, and I've been checked, but I need to go again. And
definitely, and on that, Prostate Cymru, you can go and you can get testing. I think they do lots of different sessions in rugby clubs. Of course, it's only men, isn't it?
Yeah.
You know, their wives might go with them, but it's predominantly, most men will go. They'll have a cuppa, a biscuit. You can have a blood test for £10. It's a small donation.
Prostate Cymru, go online to Prostate Cymru.
Yeah, they do events in rugby clubs all around Wales. I think this weekend they're in North Wales. Do you know what? Over the age of 40, men should be getting checked. It's a silent killer.
Yeah,
it really is. And I do that as well. But if you are willing to wait for a test and you want it cheaper, I can't do it for that price because I pay a lot more than that for the private lab that I send the bloods to. It comes back with full reports. But the Prostate Cymru, great. If people want to go, they want to meet other men.
That's really
another good meeting point.
Yeah.
So I think these things are vital for health. We need to be looking after our health.
And a lot of good takeaways. Thank you so much, Claire. It's been an absolute pleasure. And the biggest one is, let's all talk about it and not be afraid to talk about it, because men's shed, lads and dads, your clinic, when we're talking about things, problems become much, much smaller.
They do,
don't they?
yeah.
So I just thank you so much for inviting me in today, because it's been an absolute
You're welcome.
eye-opener
It's been great. Thank you.
Thank you very much.